In nursing, 30,030, the major competencies we covered were areas of the body that included, but were not limited to, the cardiac system and the circulatory system involved with that, arteries and venous. The other systems that we covered were the endocrine and renal system. We also overviewed the electrolytes. And we haven't done this as of yet, but in the last class we will overgo things such as white blood cells, red blood cells, lymphatic system, cancers, and lupus. Those are the major areas that we covered. A lot of material, a lot of in-depth coverage of those subject areas. Pretty much your big organ systems, and it was just a very in-depth and intense 7 weeks of didactic curriculum. The patient teaching that I feel most connected with in this course, I was able to help a lady find an alternative to eating with things like nutritional supplements and meal replacements such as Boost Plus Protein, and Ensure. And they were unaware these products existed. The lady was very anemic. She had some conditions, including possibly a diagnosis of multiple myeloma that was causing her to not form red blood cells adequately enough. And she was having a difficult time eating simply because it was taxing on her physically, and she was not able to meet the demands to be able to provide nutrition for herself. But with these products, they provide a nice amount of calories in quite a concise package, and they were very pleased with how the products tasted. They actually ordered, it was Boost Plus Protein from Dietary, and they got it, and I watched her drink it. She loved it, and they ordered another one in the evening for their meal there as well. Her caregiver said she doesn't remember her ever liking a product like this so much, and I think it's going to be beneficial for her because she's going to need those extra calories to help her body recover from the surgery that she's scheduled for. Evidence-based practice. My most connection to evidence-based practice in this course would be peritoneal dialysis. We had a lecture on peritoneal dialysis on a Tuesday, and then on Wednesday in clinical I was fortunate enough to have a patient who was undergoing peritoneal dialysis. So you kind of got to actually watch the process in motion. It's a different method of learning when you actually get to read it and then do it. With evidence-based practice as well, I'm also going to choose that patient for my NPR, and that I think is a big part of where evidence-based practice comes in this program, is when you get to select a patient and then you can go and you can review the journal articles and you can put some whys behind the reasons you do things. And my personal reflection of this course, I think this is one of the big bangers of this program. I think this is one of the meat portions, per se, of the course. A lot of information packed into not a whole lot of time. And it really did reinforce a lot of the physiology that you learn, and it kind of puts practice into motion, per se. It puts your knowledge out into the clinical setting, because just like my peritoneal dialysis example, when you learn about something, it's a lot different from actually experiencing it. And we learn about so much stuff that it's those things that you actually can get to learn about and then experience, I think, are the things that stick with you. The real take-home message I got from this course was we cannot underestimate our body's electrolytes, and not only the diagnostic capabilities they have, but their effects on the human body. That was my take-home message in this course, and that was pretty much a lot of the information that we covered seemed to kind of come back to the electrolytes and how they played a role on different disease states and conditions. So that would be my big take-home message from this course. Overall, I enjoyed the course. I enjoyed the didactic portion as well as the clinical experience we had. We were very welcomed at the hospital. And in closing, I would just like to say it was a very enjoyable course. A lot of hard work, a lot of studying, but well worth it. Thank you.